Hi friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant in fetal medicine. So today we are going to talk about some unusual cases, right? So I'm going to show you two sort of a very unusual sort of in rare cases. Okay. So first is a case in which we've identified. So this is a DADC twin. So one of the babies having a cystic midline avascular lesion at the base of the brain. Okay, so at the base of the brain, we do have a blood supply, and therefore it gets connected. So we do have an anterior, we got a midline, and then we got a posterior circulation to the brain, and therefore they collect, they collect together, they form a circle, and this circle is called a circle of Willis. Right, so this lesion, this cystic lesion, which is the arachnoid cyst, it is lying at the level of the circle of Willis, right? So identifying this is just the collection of the fluid between the meninges, and therefore it is called as an arachnoid cyst. It is one of the commonest midline fetal brain cysts. But the very unusual part to this cyst is this: it's very precarious sort of in position, and therefore it might pressing upon the optic chiasma. So the optic nerve which is coming from both the right and the left eye, and then they come together, there is some decussation, meaning thereby then there is some transfer of the optic nerve, they fuses together which forms an optic chiasma, and then it forms into an optic tract and goes to the occipital lobe. So this arachnoid cyst, it seems that it might be pressing upon the optic chiasma. So this is what we have tried to look around for, and I'll make you see these slides. So look very closely. So this is a cystic midline avascular lesion at the base of the brain, and this is what it is. And then I'm going to put the color. So this is a circle of Willis. But now the all thing is this, that probably if you try to look around, the end of the arrow, this is the optic chiasma. So it might look like, so it looks irregular, might be pressing on this optic chiasma, right? So this is very unusual part to it. Fluid collection between the meninges, and therefore leads to an arachnoid cyst. We can have a lot of differential diagnosis, but a midline commonest lesion avascular is the arachnoid cyst. What makes it very uncommon is this, that it is its position, and therefore it is at the circle of Willis, and therefore anteriorly it looks slightly irregular. Irregular meaning thereby that why would a fluid in between the meninges would be sort of clearly defined, should have the margins smooth. When the margins are irregular, so meaning thereby that it is trying to get into the that closed space, and therefore might press upon different neurological structures which is going on into the base of the brain, right? And the important structure that goes right at the interior to this area is the optic chiasma. Optic chiasma is nothing but the optic nerves which come from both the right and the left eye. They come together, and then there is a decussation, meaning thereby that there is a transfer of those optic fibers both from the right and the left hand side, and therefore they fuse together, and it which forms an optic chiasma, and then it gets converted into optic tract and goes to the occipital lobe. So it looks like that it might be pressing on to that sort of an optic chiasma first. Secondly, ultrasound is just a provisional diagnosis. We can never be sure about the whole scenario. So probably we might need to keep the baby under follow-up, and a fetal MR might be required so as to ascertain the pressing on this cyst onto the optic chiasma. Secondly, even if it is there, it might be a neuropyrexia, meaning thereby that just the pressure changes, and not a temporary, not a permanent damage to the optic nerves as a matter of fact, but probably a neurosurgical opinion and a fetal MR is definitely indicated, and we would like to keep this baby in a follow-up and a surveillance, right? So, yeah, very typical sort of an lesion, very typical site, and therefore might lead to some pressure changes into the optic chiasma. So this makes very unusual about this whole scenario. You're right. Thank you very much for your patient listening.